Hello everybody, this is Dr. Rick Informs, and today we're going to talk about osteoporosis. This is a two-part series. Part two is going to talk about treatment. Part one, what is osteoporosis? Osteoporosis is a loss of bone density, a decrease in your calcium, leading to bone strength decrease, leading to fractures of your hip, your wrist, and your spine, and leading to chronic pain. And who is at risk for these? Number one, if you have a family history, a history of hip fractures in your family, a history of osteoporosis. Number two, people that are frail, that are small, possibly blonde. Number three, people that smoke, terrible. And people that drink a lot of alcohol, terrible. And lastly, people that have either a calcium or vitamin D deficiency. If you're not out in the sun, remember we talk about getting some sunlight in the morning. If you're not out in the sun, you need to take a supplement. And what medications predispose you to this? And these are going to be different medications like steroids, prednisone, proton pump inhibitors, Nexium, Prilosec, these medicines for your stomach, people that are taking SSRIs, and people that are taking seizure medications like Tegretol, and SSRIs are like Zoloft, Paxil, etc. And these medications predispose you to osteoporosis. If you are on them, you need to talk to your doctor. And what diseases can be a problem? Rheumatoid arthritis, huge, low testosterone levels. So men, if you're less testosterone, you have to bump your testosterone up, sedentary lifestyle, and people that don't exercise, that are sedentary or have diabetes, are at increased risk for osteoporosis. And lastly, and most importantly, what happens? Early on, nothing happens, and that's the problem. You silently lose bone mass, your bones get weaker, and later on what happens? You get fractures, as we talked about, hip, wrist, and spine fractures. You get a dowager's hump, you start to lean over. You've seen people walking bent over. You end up having chronic pain and potentially have a fall, and a hip fracture in an elderly person equals death. You can die from a hip fracture. Mortality rate's very high. So again, stay tuned for part two. Stay healthy, stay active. Don't miss the treatment for osteoporosis. If you know someone in your family over 50 that might be predisposed, please have them listen to this.